What is cystolitholapaxy for bladder stones? Imagine having a hard, pebble-like object inside your bladder that causes discomfort or pain. That's what bladder stones are. They form when minerals in urine crystallize and stick together. Sometimes they cause symptoms like frequent urination, pain, or blood in the urine. If these stones become large or cause problems, a doctor might recommend a procedure called cystolitholapaxy. Cystolitholapaxy is a minimally invasive surgery designed to break down and remove bladder stones. It is usually performed when stones cannot pass naturally or are causing significant symptoms. The procedure involves inserting a thin tube called a cystoscope through the urethra into the bladder. This tube has a tiny camera attached, allowing the surgeon to see inside the bladder clearly. Once inside, the surgeon uses special tools passed through the cystoscope to break the stones into smaller pieces. These tools can include lasers, ultrasound devices, or mechanical instruments. The goal is to turn the stones into fragments small enough to be flushed out or removed with special forceps or suction devices. This process helps clear the bladder of the stones and relieve symptoms. Most cystolitholapaxy procedures are done under local anesthesia, where only the bladder area is numbed, or under general anesthesia, where the patient is asleep. Many times, the procedure is outpatient, meaning you can go home the same day after a short recovery period. If the stones are very large or complicated, a different approach called percutaneous suprapubic cystolitholapaxy might be used. This involves making a small incision in the lower abdomen to access the bladder directly, which is more common in children or for very large stones. The procedure is generally safe and effective. Risks are low but can include bleeding, urinary tract infections, or injury to the bladder. Doctors often give antibiotics to prevent infection and advise plenty of fluids afterward to help flush out any remaining fragments. Recovery is usually quick, with some mild discomfort like burning during urination or passing small stone pieces in the urine for a few days. From a bladder health perspective, removing stones is important because they can cause ongoing irritation, inflammation, or infections. While bladder stones themselves are not cancerous, persistent irritation from stones or repeated infections might, in rare cases, contribute to changes in bladder tissue. That's why timely treatment with cystolitholapaxy can help maintain healthy bladder function. Always remember, if you suspect you have bladder stones or experience symptoms, it's essential to consult a healthcare professional. They can evaluate your condition, recommend the best treatment, and help you understand the risks and benefits. Cystolitholapaxy is a well-established medical procedure that aligns with current standards for treating bladder stones, but ongoing bladder health monitoring remains important for overall well-being.